Hello and welcome to Public Health Live. Today's broadcast is on the future of public health nursing, and it's an update on standards and credentialing. I'm Michelle Kravitz from the Center for Public Health Continuing Education at the University of Albany School of Public Health, and I'm very pleased to have you with us here today. Today's featured speaker is Dr. Bobby Berkowitz. Dr. Berkowitz, a distinguished leader in nursing and public health, received her PhD in nursing science from Case Western Reserve University and both her master's and bachelor's of science degree in nursing from the University of Washington. She's an elected member of the American Academy of Nursing, as well as an elected member of the prestigious Institute of Medicine. We would also like to thank Tina Girardi, MS, RN, Certified Association Executive, for serving as the interviewer for Dr. Berkowitz's portion of the program. Ms. Girardi is Chief Executive Officer of the New York State Nurses Association. As required for granting continuing nurse education credits, the University at Albany School of Health declares that the speakers and their viewpoints represent no conflict of interest. To obtain nurse continuing education hours, CME and CHES credits, learners must visit www.phlive.org and complete an evaluation and post-test for today's offering. As an overview of today's topic, we're going to be discussing various ways in which public health nurses are accountable for their practice. Dr. Berkowitz is going to be talking about things like education and licensure and different types of things that agencies do to hold us accountable for practice and for our performance. We're also going to be talking about individual levels of accountability, things like how public health nurses maintain their professional acumen. And we'll be talking about ways that the public can hold public health nurses responsible for their practice. Let's see what Dr. Berkowitz has to say from a historical perspective.
Good morning. I'm Tina Girardi. I'm a registered nurse and the CEO of the New York State Nurses Association. I'm here with you this morning. I'll be interviewing Dr. Bobby Berkowitz. Bobby's the Dean and Professor of the School of Nursing at Columbia University. Good morning, Bobby.
Good morning, Tina, and good morning, everybody. Well, public health nursing has a very long history, both informally as volunteers, but formally once educated nurses began providing public health. I think we all know the history of Florence Nightingale and her focus on environments and how people lived and worked, and that's really a lot to do with public health nursing. But in the early 1800s, that's when we first detect volunteers being used to visit people in their homes who were sick and vulnerable. The first educated nurses began visiting individuals in their homes, actually here in New York City. There was an organization called the Women's Branch of the New York City Mission, and they put educated nurses out in the field, visiting mostly moms and babies in their homes. And then the first formal public health nursing began also here in New York City with Lillian Wald and the Henry Street settlement. That's a big part of New York history. School nursing was part of public health, still is today, but in the early days it was part of public health nursing. And you'll find public health nurses first appearing in schools, again in New York City in the early 1900s. And then appearing in local health departments, also again mostly starting in New York, was in the early 1900s, mostly focusing on school health, school nursing. It's going way back. If we move forward a little bit, ANA became involved in the certification of public health nurses in 1975. And then in more recent history, our scope and the ANA scope of practice and standards for public health nursing was revised in 2007, and the certification exam for public health nursing was revised around 2007. So long history. It's a very interesting history. A lot has been written about it. But I think the important thing about our history is that while the scope and the breadth and the complexity and the education, all of that has changed over time, what's remained pretty constant is public health nursing's focus on populations, community practice in community-based settings, the role of advocacy for people who are vulnerable, and prevention and health promotion.
From the historical perspective, maybe to a little bit more recent, do you Can you identify some of the significant changes you've seen in the field recently?
Well, when I first started practicing public health nursing, which was in the late 60s, going way back in 70s, our practice was, just as I was saying, it was really focused on populations at risk, some school health, a lot of focus on infectious disease, but really a community focus, and wellness and prevention, and well child clinics, and that kind of practice. Things changed a bit in the 80s when we began to get more involved in providing safety net services and more acute care for individuals who couldn't afford care. And now the transition, I think, is more out of safety net services, moving away from focusing on individuals, moving more again to a focus on populations at risk. And I think this is particularly true for risk related to chronic disease and infectious disease, and emergency preparedness is where we've seen a lot of that transition.
There's been a lot of discussion about public health performance standards and public health competencies. Could you differentiate a little bit between those two?
Sure. I think in our practice we have the notion of standards, and then, as you've said, the idea about competency. So let me just talk a little bit about what some of the accepted ways of thinking about that. So performance standards within public health generally follow the framework for the essential services. And that's a fairly well-established framework that most public health providers think about when they practice. And the essential services articulate the primary actions taken mostly by governmental public health across a population, and they're generally focused on a particular jurisdiction. So a local health department serving a particular community or a particular county. And the services include things like monitoring the health status of the community, investigating health problems within the community, educating the community about risks and communicable disease, etc. Diagnosing and investigating health problems like foodborne outbreaks, waterborne outbreaks, things like that. Mobilizing partnerships among public health and others to solve problems. Regulatory, environmental health is a great deal of regulatory action. Some personal health services, mostly linking people to services, healthcare services. And then there's an essential service about research and one about workforce. So that's this essential services framework. The standards have been developed mostly under the auspices of the National Public Health Performance Standards Program, and those standards define the specific activities, the infrastructure, and the systems that are required to carry out those essential services. So it's a fairly well-aligned set of performance standards and then services that are provided. The important thing about the standards are that they're at a system level. So they're standards around what a local health department ought to provide to a community. So if you think about the essential services related to diagnosing hazards in the environment, that would be the essential service. The standard would say you have to have a laboratory to measure water quality and to measure what the outbreak is, et cetera. So they are well aligned. There's, I think, a certain amount of confusion between what are the standards and what are the competencies, but the essential services and then the standards are then aligned with the competencies, a set of competencies.
Yeah, the public health competencies, which ones are most important to the role of nursing?
The public health competencies they're not discipline specific. They were created by the Council on Linkages, which is led by the Public Health Foundation. And this set of core competencies for public health practice includes skills related to just what you would expect. So analysis, analytical thinking, especially in terms of epidemiology, assessment, policy, program development, communication, cultural competency, financial management, leadership, community dimensions of practice, the public health sciences, et cetera. There's a whole set of them. And each of these competencies, I think, are of value to public health nursing. And there's been a fair amount of work in looking at if you're practicing public health nursing, what of all of those competencies are you using? And it's hard to imagine a public health nurse practicing without analytical skills, cultural competence. I think the difference, though, is what type of position you have in public health. So if you're a public health nursing director or manager, you're going to focus more on the financial aspects and management and leadership than you might on the analytical or the monitoring, et cetera.
There is a set of core competencies that were developed specifically for public health nursing by the Quad Council of Public Health Nursing Organizations. The Quad Council is composed of ASTDN, which stands for the Association of State and Territorial Directors of Nursing, ACHNE, ACHNE, which stands for the Association of Community Health Nursing Educators, the American Public Health Association's Public Health Nursing Section, and the American Nurses Association. Taken together, they compose the Quad Council. The core competencies are currently in the last dates of revision and out for comment right now. And like the Council on Linkages format, they also have 3 tiers, and they also have 8 domains of practice. On your screen, you should be seeing the URL for the ASTDN website, where the current set of core competencies for public health nurses are posted. These tiers represent different levels of public health nursing practice. Tier 1 is for those public health nurses who are carrying out day-to-day functions within local health departments, and generally these folks are prepared at a BSN level. The second tier is for PHNs who have mid-level kinds of responsibility. They might be doing program management. Usually they're prepared at the master's level or are very experienced PHNs. And the third level is for senior management and administrative or leadership positions in public health nursing.
Essentially what you're saying is the public health performance standards and competencies are very closely linked, and that one doesn't necessarily differentiate or is separate from
Right. I mean, they're different concepts, but for instance, the American Nurses Association, when they developed the public health nursing scope and standards of practice, so these are standards specific to public health nurses rather than for the whole profession of public health. So those standards, there's 6 of them for practice and 13 of them for the professional dimensions of the role. So the practice standards include things like assessment and diagnosis and priority setting and outcome identification, planning, implementation. Very much aligned with what we just talked about in public health standards. So you can see that these are similar to the essential services, the core competencies, and the standards. It's confusing because the language is confusing, but I think the good news is that this work is very well aligned. In nursing, we talk a lot about scope of practice. And scope of practice is practicing to the level that you're educated. And it also means that your scope will expand or change or become more complex based on new research in the field. So as we discover new things about infectious disease or new things about interventions for chronic disease, public health nurses are responsible for keeping up on the research and then incorporating that research into their practice, which then enhances their scope.
Are there specific regulations defining the education and credentials required to be a public health nurse?
Public health nursing is a role, just like critical care nursing is a role. And the skills required for public health nursing are generally taught at the baccalaureate level. So some agencies and some states, for instance New York, require the baccalaureate degree to practice as a public health nurse. Not all states do that, and not all agencies do that, but that's certainly true for here in New York.
Are there any specialty certifications that can be acquired by a public health nurse? And can you maybe talk a little bit about the certification process?
Right. The American Nurses Credentialing Center is the national organization that provides the specialty credentials. The credential for public health nursing is called Clinical Nurse Specialist in Public and Community Health. It's granted through that's a credential. It's granted through a certification process which includes an exam, and that exam is administered by the American Nurses Credentialing Center. When public health and that exam has just been updated a couple of years ago. When the nurses, including public health nurses, get recertified, so the certification is good for 5 years, and when you're recertified, then the recertification generally relates to the number of practice hours. You have to have a certain number of practice hours, continuing education. There's some ability to look at research and other kinds of activities that would maintain your competency as a clinical nurse specialist in public health.
Now we're going to discuss credentialing from the viewpoint of what happens within the workplace, and also discuss specific types of certifications for public health nurses and generalist type certification for people who work in public health in general. There is credentialing that takes place within the workplace as well, and this is verification of qualifications for a particular job. In this case, we're talking about public health nurses. So we generally verify someone's identity. We verify that they have the required licensure as a registered nurse to practice. We verify their education, meaning that they graduated from where they said they graduated from. We verify their employment history, and many times we have to do this because we have to ensure that the nurse has the qualifications for reimbursement for the services he or she is offering. Public health nurses who obtain a master's in public health degree and who graduated from accredited programs may sit for another credentialing exam that is sponsored by the National Board of Public Health Examiners. It is not a nursing-specific exam, but a general public health credential. And actually, this may present a dilemma for those nurses who are MPH graduates. They may be wondering, should I get this other credential or should I pass on it? The URL for the National Board for Public Health Examiners is on your screen. Recently, another opportunity became available. Public Health Nurse Ready, or PHN Ready, is a free online certificate program available through a grant from the U.S. Department of Labor to the University at Albany School of Public Health. The program provides 24/7 self-paced access to courses that are relevant to the Quad Council core competencies for public health nurses. Information is available on the web at www.phnready.org. Upon completion of the required and elective coursework, a certificate is awarded. So far, over 700 nurses have enrolled in this program. All across the country, public health agencies are discussing and preparing for accreditation. The Public Health Accreditation Board, also called FAB, is offering a voluntary program for state, local, territorial, and tribal public health departments. FAB's goal is to improve and to protect the health of every community in the U.S. by advancing the quality and performance of public health departments. Their beta test of this program was released in September 2009, and they have celebrated their official launch just yesterday, September 14, 2011. FAB requires as prerequisites to the accreditation process that agencies have a community health assessment, a community health improvement plan, and an agency strategic plan. Public health nurses throughout the country have already contributed mightily to this effort, and they will continue to do so. To learn more, go to FAB's website. The URL is on your screen. Now let's return to Dr. Berkowitz and hear more about what she has to say about the future issues for public health nursing.
So how does accountability come into play, and who holds public health nurses to the set standards of practice?
Right. Well, accountability is one of those important concepts that, again, is highly aligned with education. So your scope and your education, your particular licensure, your certification. It's also aligned with what an organization uses to measure performance. So, we would like to think that organizations pull down the scope and standards, the nursing scope and standards, that they're utilizing the broader public health competencies, and that they're really looking at the performance standards. But when you get to the individual performance level, either an individual or a team, that's when organizations need a couple of things. They need a well-developed performance appraisal system that has measurable, that one can actually measure the performance of an individual public health nurse or a team. So a lot of accountability comes through well-managed and well-done performance management systems within an organization. But in addition, nurses need to hold themselves accountable. We talked about how people stay up to the scope through reading the literature and going to conferences and being parts of professional organizations, holding themselves accountable. The public has a lot of ability to hold nurses accountable in public health, particularly through boards of health. There's a whole system of within local counties and states to hold groups and individuals accountable for their practice. So there's a lot of levels, but I think one of the most important levels is the nurse themselves to keep up with their practice, and also a very well done performance appraisal system within an organization.
There's a lot of talk recently about the Affordable Care Act and the impact it'll have on healthcare in general. Do you see any significant changes facing public health nursing today as a result of some of those changes?
Well, yeah, there's both some unfortunate changes and then some interesting and exciting changes. The public health nursing workforce is shrinking across the United States. Now, a lot of that has to do with the financial and economic situation of local and state health departments. So there's some real problems in terms of state and local government budgets. And so the workforce has shrunk because of that. In other respects, the workforce has shrunk a little bit because the traditional practices have been either contracted to other organizations. For instance, visiting nurse service does a great deal of the individual work that public health nurses used to do. So the work has been preserved. It's just changed organizations. The concern that I think most of us have about the shrinking workforce is that a lot of those services, however, are just not being done. So that's I think it's reduced our ability to have an effective prevention agenda throughout the country, and one that does not have a lot of variability from state to state. But I do think that there's some steps that we could take to reinforce public health nursing's role in prevention. I think there's some things that we could do to enhance that and to bring that focus back. One of them is to really work on a set of measures that show the contribution of public health nursing to a very specific set of prevention priorities. So if we take chronic disease, for example, most individuals with chronic disease live in communities, and we want to keep them in their communities. We want to keep them out of acute care and out of hospitals and out of long-term care facilities as long as possible. So I believe that nurses have a role in working with other providers, other teams of providers and colleagues in healthcare to work on transitions of care for individuals and families who are experiencing chronic disease. I think that's an important role. It doesn't mean that public health nurses are doing acute care with individuals. It means that they're part of developing a system of care for populations with chronic disease. So I think that's one very important place. So developing measures that show how we contribute to population health, particularly prevention, to begin thinking about our contribution to these new systems through the Affordable Care Act has been thinking about systems for prevention and transitions in care. And then I think a third area is to really understand a lot more about the public health nursing workforce. So how many of us are there? Where are we practicing? What's our educational level? What are we doing? What's our practice look like to help us really think about what our roles should be in the future?
Some of what you just discussed related to workforce data, education, and role and responsibilities fits very nicely with the IOM report on the future of nursing. Would you like to comment at all on that?
Well, as I think most of us have been following the work of the IOM Future of Nursing, which has an emphasis on this whole idea about scope of practice, nurses working to the top of their scope, the baccalaureate in nursing for entry, and more doctorally prepared nurses. But a fourth key message and key area is to enumerate and understand the nursing workforce. And I think the emphasis, again, is getting a better data system to track the nursing workforce, no matter whether they're inpatient, ambulatory, in community, wherever we are, to understand how many we need and where they are, and what our future educational system needs to look like in order to provide enough nurses into the workforce. So I think the IOM is really calling us to do this, to develop this kind of data for the workforce, and it would include public health nurses in that. Just to go back to this area about chronic disease. So I think earlier we talked about that one of the primary roles for public health nursing has been in terms of prevention and health promotion. And if you look at public health departments, local health departments across the U.S., where most of the population health focus has been, is primarily infectious disease, so control of communicable diseases across populations. And then this relatively new focus on chronic disease, in particular individuals at risk for developing chronic disease. And then the focus on preparedness, so emergency preparedness, et cetera. So I think public health nurses have long practiced in the area of communicable disease control and been fairly involved in planning for emergency preparedness. I think I'm hopeful that one of the new areas of emphasis would be in helping individuals manage their chronic diseases or living well with chronic disease, and in preventing chronic disease. So this is in terms of asthma, diabetes, obesity, cardiovascular disease, many of the cancers that are now chronic disease, osteoporosis, et cetera. I don't think we've thought as much about our role in those diseases in public health nursing as we may be certainly in the future. Again, that's an emphasis in the Affordable Care Act, those areas in particular. The National Quality Forum has been working on high priority measures for understanding more about this handful of chronic diseases that cost the system a lot of money. So I think this is where a place where public health nursing could be moving and probably ought to be moving in terms of more emphasis.
Given what you just said, I can also see a real emphasis for public health nurses in the healthcare home model that's part of the Affordable Care Act. Would you care to comment on that?
Well, the idea of the patient-centered healthcare home, in some areas it's called the medical home. The idea there is that the whole population, all of us, ought to have access to a really good system for primary care. And that within that system, we would not only have our episodic care managed, but the prevention aspects of our lives managed as well. And then, when needed, specialty care. And in order to do that well, we know that these healthcare homes need to have a range of providers, including advanced practice nurses and registered nurses, along with dentists and pharmacists and physicians and all kinds of other folks, social workers. But then we also need a system of care coordinators and care managers who help people self-manage chronic disease and other kinds of conditions. And then the connector, the navigator connector part, which is to help people connect with services and resources out in the community. And this is where the public health nurse comes in, to focus on the determinants of health. So how are people living? What are their neighborhoods like? How much exercise do they get? How far do they have to go for healthy foods? All of those determinants out, the socioeconomic status, racism and discrimination, and because we know this is really what impacts health. Probably 80% of how healthy we are comes from determinants of health. That's where public health nurses are practicing, in that arena where the determinants of health are at play. So I think if we really had a strong patient-centered healthcare home, it would include the public health nursing component that would really help people manage their way through those determinants of health.
You spoke about some of those social justice issues that are part of the determinants of health.
Right.
Would you like to comment on public health nurses' role in policy?
Right. Well, I think it's one of our most powerful tools because, again, the public health nurse practices at the population and community level, and they are a window, if you will, on a community's assets and strengths, and when a community is having concerns and problems. And the public health nurse gets a view of both at the individual level, you know, school kids and moms and babies, and but also how those problems impact the whole health of a community. So they get this sense and idea about how well things are working in a community. And if you take things like tobacco use as just an example, one can approach tobacco use on a one-to-one basis with individuals to get them to stop smoking, but it's often more powerful. A more powerful tool is a policy tool, which would have an ordinance that would say, you know, you can't smoke in restaurants, and now you can't smoke in parks, and it's really expanded. So public health nurses to advocate for those kinds of policy changes, both at the community level, where local ordinances can do a great deal to manage health, to state, to national advocacy is really important. I see it as a practice tool, not something you do when you get around to it, but it's something that you need to do every day, whether it's advocating at the commissioner, board of health level, or Congress. So I think it's a huge tool for public health nurses.
Advocating for our patients is something that we do every single day. So certainly doing that in the public policy arena is a perfect fit for the role of a nurse. Absolutely. Do you have any closing messages that you'd like to leave with us?
Well, you know, I've followed public health nursing for many, many years. How I started my career, and worked in state and local health departments, and now in an academic setting. I've seen the public health nursing practice change over time, and I think it's due for a renaissance, if you will. I think we have some opportunities here with the Affordable Care Act, with the focus on the patient-centered home, a lot of the changes going on in healthcare settings with increasing access and a focus on quality and a focus on cost. So I think we're at a pivotal point to either engage in that dialogue and that work as public health nurses, or I worry that our practice may not grow and blossom. So I think it's sort of time for a renaissance. I think much of the individual and family services that used to be a part of our practice are now provided in other sectors, or tragically not at all. And I think we understand that progress toward a healthier population should be the primary purpose of a reformed system, not just insurance mechanisms, but truly a movement toward a healthier population. This has been the expertise of public health nursing, and I think we need to renew our focus on those efforts. I think the current approach to health reform is one focused on illness. And I think we need to advance the prevention agenda in a powerful way so that it's part of the rollout of health reform, not just changes in the illness care system. So as we talked about, focus on policy is a powerful tool. Advocacy, I think I used to teach, I had taught health policy for 14 years, not just to public health nurses, but to nurses and non-nurses. And I was always amazed by how little people know about basic civics and how legislation is orchestrated and how little we understand advocacy. And so as part of this renaissance, I would like to see public health nurses get more skilled with those tools. I also believe that we need to engage much more in practice-based research. So, hospitals and healthcare systems, I think, have been pretty good, especially recently, in pulling staff nurses into research councils and getting them involved in practice-based research and thinking of inquiry as part of a day-to-day challenge. So you every time you face a patient, you think about how could I improve this? How could I do this better? How could this particular intervention be improved upon? You're always asking that. Same thing ought to be happening in public health nursing. The new public health practice-based research networks, of which New York is a part, and many states are part of these networks. This is a huge opportunity because it's at the local health department level, really, where the inquiry is happening. So practitioners in public health are looking at, how do we do tobacco control better? How do we really help kids have more nutritious meals? I mean, they're thinking about these questions, and public health nurses can be, and I think are, but could in a more robust way be participating in those conversations. The research committee of the Association of Community Health Nursing Educators, ACHNE, recently developed a set of priorities for research in public health nursing. And they focused on two areas. One is research and study related to population-based health outcomes. So what are the outcomes, what are the priority outcomes for populations? And then they looked at methods that public health nurses are most likely to use, and so they need to be educated in those methods. So they looked at, in the population health outcomes, they looked at vulnerable populations, outcomes for vulnerable populations. They looked at eliminating health inequities as a place for research. They looked at chronic disease and some of the newer chronic diseases, so cancers that have become chronic, et cetera. And then in the methods part, they particularly focused on public health nursing needing to be expert at community-based participatory action research, where the community is a partner in research, becoming much more expert at methods in epidemiology, much more expert at looking at large population databases so that we can be looking at variables within populations and across populations that are of interest to public health nursing, but also are key to reducing impacts of disease and disability. So I think that's the call from that association. I think there's a lot of work going on with some of the major research funders that are looking at these same things. So I think this, what I refer to as a renaissance, is really one focused on understanding our practice better, measuring our practice better so we know how it contributes, getting more involved in working with systems around the Affordable Care Act, and then having a pretty well-defined research mission that will take us into the future, in particular related to chronic disease control. So, you know, I have a lot of hope and enthusiasm that our future will look a little brighter than it does right now with the workforce issues.
That's great. Thank you for sharing your insights with us this morning.
Thank you.
We wish to thank Dr. Berkowitz and Ms. Girardi for being with us today, and we wish to thank you for attending today's broadcast. You will note that at the end of your handouts there are a number of pages of resources. Use these resources if you'd like to look further into some of the topics that were discussed today. And please don't forget that if you would like continuing nurse education credits for today's broadcast, you must go to www.phlive.org to complete the post-test and the evaluation form. Thanks again for being with us.